We're talking about coronavirus restrictions and, well, what are the knock-on effects of what has happened, particularly with our health service. Our stories like this: a growing number of cancer patients are privately raising money to pay for treatments or screenings because of the impact that coronavirus has had on NHS services. NHS England said 80% of cancer patients continue to receive treatment during the pandemic, but tens of thousands have experienced delays. Some have been forced to fund biopsies or scans, and others have paid privately for surgery, fearing that more delay could allow their cancer to grow. Wendy Peake has a rare cancer which became incurable once it spread to her liver. She was days away from starting a clinical trial for a new treatment method in March when it was stopped because of the pandemic. To pay for her treatment, she's been fundraising, going door to door and asking strangers to help fund her cancer treatment. Wendy joins us now. Afternoon to you, Wendy. I'm bound to start by
Hello.
asking, how are you? How are you doing?
Yeah, I'm doing very well, thank you. Yeah, we just had a quite an emotional weekend. We were in the Sunday Times, and yeah, it's always very emotional.
Well, I saw this, hence the reason why we're speaking now. I saw this and I read the piece, and I said to Ricky, our producer, said, look, it'd be really nice to be able to speak with Wendy because this story wouldn't have made any sense a year ago. We wouldn't even have the parameters or the facts to be talking about this because nobody knew what this coronavirus thing was that was lurking around the corner. And here we are today, and you are one of many people in this position where what you were hoping for was some trial treatment, as I understand it, and that just came to a crunching halt.
Yes, basically, I have a very rare eye cancer. So I had an eye enucleation in February 17, and I was told at the time that I had a 40% chance of it going to my liver, and if it went to my liver, it would be the end of the road. So in November 19, when tumours were found in my liver, I thought that was it. And then in February this year, I was told that I was a candidate for a remarkable trial, which has a 65 to 70% success rate. And of course, I thought I'd won the lottery. I thought I'd won the biggest check of all, which was to
Wow.
spend more time with my husband and my children. And it was all due to go ahead. In fact, on the 13th of March, I had the first part of the trial, and the medical professional said to me, thumbs up, this is the start of your trial. And everybody was ecstatic. And then on the 23rd of March, I got a phone call out of the blue from an admin person who told me that my trial, the actual chemo part of it, was due to start on the Friday, the 27th of March. And on the 26th, I was due to go in for a routine heart scan, which was part of the trial, and to stay in overnight and have the chemo first thing next morning. And I was told, don't come in for the heart scan. And absolute panic set in. And I said, it can't be right. I'm on the trial. It starts on Friday. And she said, I'll check. And she went off, and I made several phone calls. And then I found out that it was cancelled. That was it. The specialist nurse who spoke to me said, it's not going ahead, Wendy. It will never go ahead in this hospital again. We will never put you through all those assessments, because to go on a trial, there are numerous assessments, extra MRI scans. They absolutely check everything to
Hmm.
see whether you are a candidate. And I was just devastated, really, absolutely devastated.
I can't even begin to imagine, Wendy, how this would have. You must be made of pretty strong stuff in order to have
Oh,
just
yeah.
mentally digested this. It's, as you say, being handed the biggest prize of all and then being told, sorry, it's not yours after all.
Yeah. I mean, I think you're resilient because you have to be resilient. And there's nothing quite like wanting to live, to drive you on. Yeah,
Yeah.
sorry.
No, that's
I
all right.
thought I was strong, and I am stronger. It's just whenever there's been any publicity, we're very quiet people. And to have been driven to these lengths and to feel as though you've sold your soul for money
Yeah.
is
Well,
hard. But
you certainly haven't done that in any shape or
we
form.
do we do draw strength from people's comments and support. We really
Yeah.
do, and that makes it
Of
bearable. Yeah.
course, it's interesting to get your story, and of course, we know that you're not alone either. This
No,
story is replicated in different forms and different
no.
ways up and down the country. You're trying to raise money though, and
Yeah.
is that to resume the trial elsewhere? Is that to go to another
You can,
place?
yes, yeah.
What are you trying to achieve?
Well, we found it out in June, so we went from March till June, wondering what on earth we were going to do. We tried to see if we could get the trial abroad. It is standard treatment for people in Germany, as I understand it, and in Holland. So we tried to see if we could access it there, but of course there were no flights out or anything, and we'd have to pay for it privately. So then our lovely, wonderful oncologist told us that we could have it in one hospital in the UK privately, and it was Southampton Spire. And could we, obviously, where Manchester based was South Manchester, and he said the treatment is £40,000 per round of chemo, and Wendy, if you could just have one round, it's better than none.
Wow.
So I kind of, without thinking about it, I said, yes, we'll take it, and then put the phone down and thought,
Yeah. You thought, what do I?
how are we going to afford it?
And
Yeah,
what's, I mean, yeah, when somebody throws a figure like that at you, your instinct, as you said, you want to live, and your instinct is yes. And then I can see that afterwards you're thinking, hang
yeah.
on a sec, 40,000 quid. So what did you?
But it wasn't that, it was the fact that I mean, originally in the first hospital where I was due to have the trial, they told me it was between 50 and 60,000 pound per round of chemo, and I'd possibly need 6. But then when Southampton reviewed my case, they said I'd need 3 to 4, and it was 40,000 pounds. So that brought it down, but still not down enough. And so
Yeah, just the £250,000 instead
yeah, yeah,
instead of
yeah.
350,000.
Then
So
my daughters started the GoFundMe page the end of June. My husband was very reluctant. I was uncertain. We're very private people. Even our best friends didn't know it'd gone to my liver, because throughout all of this, I've been really healthy and remained at work. And and then they just said, we're doing it, Mum
yeah,
and Dad. And it was funny to be overruled, but they hit the button and that was it.
yeah.
And I think within the first day we'd raised 10,000, and it was just amazing, really.
And
Yeah,
I'm just looking at the page now, and it's £102,411, which is
yeah. It was
astonishing.
99. It was 99 before the Sunday Times, and
Wow.
it had slowed down an awful lot. And we were like, "This is it. We've done all we can do."
Yeah.
And then we went in the Sunday Times, and it's gone up, and we're truly grateful for that. Yeah.
And what will happen now, Wendy? When will your treatment begin? Because presumably there's enough money here to begin the treatment, or do you have
I
to
have
have the whole lot raised before it can?
No, I had the first round the end of July. So it's quite a complex procedure where it's under general anaesthetic, and they isolate the liver and put the chemotherapy in so it doesn't affect the rest of you, which is brilliant. It's quite a physical assault on the body, and you have to
I'm
be very
sure.
physically fit. But I survived it, and that was brilliant. The next round is next week, and the private hospital, write to you 2 weeks before asking for the money up front. And again, because of the GoFundMe, we can fund it, and we've sent the check off while we've done
Yeah.
we've transferred the funds. And now, of course, there's the next one will be in 6 to 8 weeks time after the one next week. And we're thinking, has our fund, have we done all we can for the fund?
Yeah. It sounds as if this is, I mean, who would have thought this turn of events could have had so many other devastating effects? We've been talking a lot throughout the program about the sort of the unfathomable nature of the curious world we've all found ourselves in. And I suppose, much like yourself, Wendy, we understand some things, and there's other bits that you scratch your head and think to yourself, this seems crazy that we're not, we've stopped people's treatment, often life-saving treatment in this respect. And it's only when you're faced with this, on another point, really, you begin to realise the cost of treatment. I mean, this presumably 40,000 quid doesn't just go in the back of an oncologist's pocket. This is the cost of treatment, right?
Yeah, and I know when I was first told it was if I had it in a Harley Street clinic, it would cost 50 to 60,000 pounds per round. I was absolutely aghast at it, and the lead consultant at the time said to me, "Well, don't be too taken aback. about it, there are other cancer treatments which are of a similar cost, and so
Yeah.
I thought, right, okay, then, so this isn't out of the ordinary, that other cancer
Yeah.
treatments do cost this amount.
But you'll
And
be, go on.
I think because it is a rare cancer as well, it only affects 6 in a million people. Not a lot of research goes into rare cancers, I feel. And so this was such a prize, really, that somebody is has been doing research into it and has this trial available, which hasn't been available before. And as I understand it, it's successful in 65 to 70% of cases in terms of reducing the tumours in size, stopping them from growing. And on 2 occasions now, they've told me, and in some cases they completely disappear. So why
Wow.
wouldn't you?
Yeah,
Why wouldn't you raise funds and go for it when you've never been ill with it either?
indeed.
I think I'd be more accepting of it if I was ill and couldn't get out of bed
Yep.
or whatever.
But you're
You
feeling
know,
mostly fine.
well, yeah, I mean, clearly, emotionally, we have our downs.
Of course.
I've never been ill through it at all.
That's yeah. Many people would be.
Emotionally, it can be crippling.
Of course it is, and for the family as well. And then you're concerned
Yeah,
about the family because you don't want them to be upset about you. And this strange compounding, I've been in that place in my own family, Wendy, so I understand
yeah,
that kind of curious, circular sense of all wanting to avoid each other's upset. But actually, the bottom line is everybody's a bit upset when somebody
yeah.
is ill. We're going to give the address out as well. I just wish you loads of luck, Wendy. You have an amazing spirit, and it looks as if you're on the right path here. And thank you for speaking with us. I know it's not easy, and as you said throughout our chat, the last thing you expected a couple of years ago was to be giving interviews to the Times and turning up on national
Yes.
radio. It wasn't in the diary, that one, but you've done it with brilliant fluency and bravery, and thank you.
Thank you very much for giving me a voice.
No, not
I
at
hope it
all.
helps others.
No, we will keep in touch as well. Wendy, thank you. That's Wendy Peake, who's fundraising for her own treatment after essentially COVID measures stopped the trial she was on.